Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and we have an very interesting case here. Seems like everything we work on is interesting to me, but with the regular, easy orthodontics, we never did keep records and stuff on them. Is not wasn't much reason to show them to people, but things that had something that you needed to know about, we try to get in there and show those cases. And this one right here has a major problem that people need to understand and know about it. And I'm going to get started in here real quick, and we'll try to save time. Real nice looking young man, and he's about somewhere around 24, 25 years old. And you look at him, and he's got the facial structure is good, the height and the vertical height of the lower third of the face, things look fine. You look at him from this direction, his chin's a little bit off to the left side of the mouth, but not much at all, and just slightly over. In other words, he's got a little more vertical dimension down here than he would need, but looks perfectly fine on the young man, and so I'm not going to try to change that much, except we do have to take this guy's wisdom teeth out, and that'll help bring this down just slightly. So let's get to finding the real reason for wanting to fix this fella's teeth up. All right, here. All right, if you look at him when he smiles, the lip line's fine and everything else, but if you look at the teeth real close, you'll see why he needed to have some orthodontics done, because his teeth were crowded and were not attractive at all, and he despised his teeth. And here we look at the teeth, and they have food structure all the way around the necks of the teeth and all in between the teeth. He is not taking care of his teeth. He does not like his teeth. And I had a real pretty aunt once when I was just a little kid, about 6 years old, and I really liked this lady, and she had ugly teeth. I mean, they were terrible. And she could not wait till she could get her teeth out and get some dentures that looked nice and straight. And that was the only way they could get them done, was just to take them out and put you some straight dentures in there. And that's the way people straighten their teeth years back. And that was a long time ago. It was nearly 88 years ago when that took place. Now, here we're going to try to straighten this out, clean them up and everything else, but the food material has stayed in here, and the acid forms in there, especially if you eat a lot of sweet stuff, things, and in just a few minutes after you eat something sweet, the bacteria, you can break it down into acid. Now the acid has to eat on it for a long time before it'll turn white like this. But you cannot get rid of that color. We'll look at that later on down the line. Now the Class 2 Division 2 case locks the jaw back here if he had a temporomandibular joint problem, or the condyle was crowding the retrodiscal tissue. This would help open this up. We're going to move his lower jaw forward to some. In other words, when you come in here and take these teeth and move them out of the way, then the jaw in most everybody will come forward to some extent. Then you may have to take it forward a little bit more. Well, this guy's got a midline deviation right here. You see this is center on this side, and that, yeah, that's the same thing. These are lateral teeth, cuspids lateral, and the cuspid over on this side. So let's get on with this, and I'll show you some more part of it. Over the right side of the mouth, you see the cuspid is way out here. It's kind of crowded out, and it's over on this side. This area is the teeth got in earlier, and it has a little more room than the other side of the mouth where the lateral is back behind here. Now let's look at the other side of the mouth, and you can see the cuspid where it's coming down in place. Still food particles all over the teeth. And this guy, if he's eating a lot of sweet stuff, you're going to have decalcification. And you might as well tell the person before you start. I mean, they've got to brush this off, keep it off, take fluoride toothpaste or have them treated with fluoride will help break the acid ability to eat into the tooth, but you cannot restore that color to the teeth. So you can see down here, he has a big cavity right there. It probably should have taken this tooth out and moved the wisdom tooth up, but there we didn't. Now, this is going to change. We're going to have to widen this out in here and line up these teeth. And for years they thought you could not expand the cuspids, but you can. The problem is, don't try to expand cuspids by leading them this way. Take the roots back, and you can carry the cuspid back here wherever you want to, and it won't have any sacred thing position it's going to go to. So let's get on from that. There's just a world of things to learn in this type of situation here. We've got this deep bite. This is too far. These teeth are leaning back. Also, this one here. Normally in a Class 2 Division 2, this lateral will come out on top of these. It'll come in later up here and come out there. And that one's a little like that. This cuspid's coming down, the one over on the right side of the mouth, and it's coming down in the wrong place. This one is also. Let's get a better look now here. The lower teeth should be further out. In other words, this point right here on the tooth should be in this groove. In other words, this tooth should come out something like this, and it would be back in this area, and that would bring the jaw forward. But his jaw is locked back. You see how these teeth come down? When he chews, it slides right up in there. Now this cuspid is supposed to come down in that groove right there. So we're going to try to bring these teeth out, and we're going to expand this in the front right here, and keep this coming down in a Class 1 relation. And this will all be further forward than it is now. And the wisdom teeth on this young man, the wisdom teeth are very almost impossible. They're through growing, and I think he's about 25 years old, and they're not going to get any more space. So we did recommend removing them, and they got them out. This is in a crossbite right here, the bicuspid, and we'll jump that back on the right side. Over on this side, now we're worse Class 2, like this portion of this tooth should be brought out to here. So it'd be fitting more like that. So we've got to move this part further forward, and when you look at it from the front, you can see when we got started in there, this needed to come out. The midline's better now than it was. We've got this all straightened up. It was a lot worse down here. Now these cuspids are at a kind of an angle, and you bring the root back at least where the crown is, or a little further back, and this cuspid tends to stay there. It doesn't have any sacred position, and you can't say, well, the cuspids never go out there. If you spread them out, they'll come back. They do not come back if you put the roots back from that reason. If you got other reasons of closing in, it will give you some problem. Now I want to look and see these white spots in these teeth right here. all around his mouth. And wherever the acid eats through there, a little bit further down the line, this will just come off. You can scrape it off. But if you get to it in time and use fluoride and mineralizing it and keep them clean, you can get mineral to fill back in there, and this will harden up to some extent. But I'm not sure that we made that correction with him. Now, somebody who brushes bad and is an adult, we can take these brackets down, right down on the gum line right here, and they don't tend to decalcify. For something like this, when you start doing it, you need to put this sealant all over the teeth. I mean, and then if he doesn't brush it, it doesn't decalcify any worse. Now, I don't think he really took care of it as good as I would like for it to, but you make the teeth look good, and most people will get out of bed and go brush their teeth when they forget to at night, especially if they eat something sweet. Now, you could use your brackets down here. I just lined this up and have an arch wire, but I had the edges up here. And this is something you can do on adults. You can put the lower anterior teeth so far down, if the crown of the teeth is pretty long, you can bond these brackets down here on the gum line and just run the arch wire down around that and still keep the edge of the teeth right. You do not have to put your brackets in exactly the place you have to have them if you just leave them in there straight. But you can bend your arch wire and bring it down, and you can put the brackets lower, and you don't even see them as an adult. So that's ridiculous putting these clear stuff on the lower anterior, unless you very rarely see somebody talks and you see their teeth like that. Now, we've lined up the upper, and we're jumping. I'm not showing just regular orthodontics, but what things we want to point out. And in this one, the essential thing was keep the decalcification down, use sealants on these before you put the brackets on, get the person brushing their teeth properly before you start if you possibly can, and then you got to stay over them. Now, if you talk to this guy and he still doesn't brush them, you talk to his wife or his mother or somebody that's responsible for it, because if you keep doing it very long, you're going to have cavities all up in these teeth right here, and that's something you can't get rid of. So let's go now to another side, and you see this cuspid was up here. We've got it right down in the crack where it should go. And over on the other side the same way, the cuspid's down in place. You're going to have these white spots, so the rest of this guy's life, if he keeps the teeth, unless he crowns them or cuts all that out and puts composite in there, I'd rather keep the white spots than do that. And we took this arch wire, another little secret. See how the arch wire goes down, and we go across down here on the bottom, and that guy can talk and everything. You don't even know he's got braces on his lower teeth. And you can do all your adults like that. You don't need all these clear brackets down there on the lower anterior, provided the crown ratio is good enough. Now the upper teeth are lined up and in good shape right now, and the lowers are too. You can see everything. So we've expanded these, but these cuspids have their roots back a little to the distal of where the crown is. Now, if you just lean that cuspid out this way, it'll tend to go back, and that's what the problem was. Now, this tooth over here is a big filling in it, and it might have been better to remove that and take that wisdom tooth over there and bring a second molar up in there, but it looks like it's in pretty good shape, so we did not do that when we did this case right here. Now here's his cephalometric x-ray, and his age is 25 and a half right there, and so that makes the difference. There's not going to be any growth in this at all, and so we look at the panorex, and this is the jawbone coming down here. This wisdom tooth is up underneath that, and if you leave it there, it's going to put more pressure on this, and this will be an area where he'll have trouble. So we go ahead and remove the wisdom tooth, or I didn't do it. I send him in and take them both out while you're at it, and get this done, and that's going to clean up an area that he can get in and brush and take care of better. Now my only thing that I might have done, you see, well, if this cavity is really bad here, we would have probably taken this tooth and pushed it back up in this position there. It'd take a little bit longer to do the case. So here it is, and we've still got these wisdom teeth giving us trouble there. They're up underneath the bone, and that's not going to grow, so you have to do something with them. So we recommend him removing that, and so they have taken the wisdom teeth out, and we finished these in nice order, and this is good where he can clean behind this, and hopefully he will really clean his teeth up, and this is coming along real good. We've got everything lined up. Let's see, and here the teeth and the roots and everything are parallel, and it's finished out. And this was when we started, and that's when we finished. The midline of the bottom is over here. Oh no, I take it back, it's here. And the midline here, so you have to bring this side forward, and then bring this over this way. And now we've got it almost correct, but slightly off. And the decalcified area of the teeth is still decalcified, and it's going to be that way from now on. He needs to keep it as clean as he can, and I would recommend fluoride toothpaste, something to keep fluoride on that and keep the teeth as clean as you possibly can. And that's changes this guy's, the way he looks at his teeth now. He likes them, he smiles, and he's got a nice looking smile, and this facial structure and everything makes a difference. And we put a retainer in him with a little bite plate up here at the top, and that keeps that in place. And this is expanded, you see, and brought forward. In other words, we brought these teeth out here and let the lower jaw come forward, and that puts the cuspids in the right spot. Now that's the lower teeth, and we expanded this, and whoever told you that you cannot expand the cuspids back here, you can do it, but you've got to keep the roots of the cuspids slightly to the distal of the crown. You can't just go in there and spread them out like this. They'll come back to that direction. But you look at the position of these cuspids, and you come up here, and you look at where these are over here, and you're going to have a lot less space in here, and we have expanded that. And if that young man continues to wear it and stays with a retainer for a few years, everything, this is 98 right here, and this was 94, and it's still going good. The only thing I think I would have been smart would be to take this tooth, move it up to here, and put the wisdom tooth in that place, and throw this thing away right there, that I might do today on that. So thanks for watching, and this is a guy with a nice smile now, and he can really open his mouth and smile big. And if you were his girlfriend, you would appreciate having the teeth cleaner than they were when we started. So thanks for watching this, and if he takes care of his teeth, he's proud of them now, and he smiles big, and he shows them off, and he takes care of them better than he would if they were crooked and messed up. So thanks for watching, and hope you'll join our group, and I'm going to shut this one off right here, and hope to see you again, and I'll stop.